Hello, my name is Charlie Dennard. I'm with Dr. Mario here at the Adult Dentistry Center in Escazú, Costa Rica. I'm part of the CostaRicaHospital.com website, in which we connect potential patients in the United States with qualified, exceptionally qualified doctors and dentists here in Escazú, Costa Rica. I'm here today once again with Dr. Mario, and I wanted to just introduce Dr. Mario to you and to ask Dr. Mario to give a little background about his educational background, his experience as an implant dentist specialist, and go from there.
Thank you very much, Charlie. And just like Charlie said, my name is Dr. Mario Garita. I have been in practice here in my home country for about 16 years now. I did my postdoctoral degree at University of Miami, which I did is the specialty in implant dentistry. Why did I choose implant dentistry? You know, that's very interesting. My grandfather, who was a dentist, he always complained about how hard it was to make a patient who didn't have any teeth in his mouth happy with a removable denture. And actually, that's very hard. But implants came in to help people like that get a better quality of life. Now I can fabricate full mouth, all the mouth in all the teeth in the mouth, all the upper dentures, lower dentures, but I can make them fixed. Now they are not removable. They are just like natural teeth. So that's a new level in dentistry instead of staying where my grandfather's dentistry was.
Let me ask you a question. I know that over the years you've established yourself in the credibility of your practice. How long have you been doing implant surgeries now? How many years has that been?
Well, ever since I came back from my specialty here, that's 16 years ago, and we do an average of 1,000 implants a year, and mostly to American patients who come here to look for high quality dentistry at a fair price. We don't use cheap materials. We don't try to save on any of the work that you need, because we know and we understand that dentistry, it's something that should endure. You want to do this once and not have troubles for a long time. And that's what we try to do by using our best materials, best equipment, and highly trained personnel.
You know, going back to the whole idea of implant dentistry, there are two procedures for implant dentistry. One is called immediate loading, where the implant is placed immediately with the abutment and the crown, and then there's the two-step protocol where someone comes in for the loading for the post, and then they come back several months later for the abutment and the crown, the permanent crown, to be placed. Could you explain to me the advantages and disadvantages of someone wanting to do immediate loading right off the beginnings, because some people may not be qualified for immediate loading on their implants?
Absolutely. Just like you said, there are two types of implant protocols. Let's start with the classic two-stage protocol. This is the safest way to go. It's a longer route, but like I told you before, we're looking for a long time endurance of your treatment. So if you want to save on time, if you want to save on quality, this is not the area to save in. This classic two-stage protocol, you will need to come to Costa Rica 2 times. Mm-hmm. First time for 3 to 4 days for implant placement. You will go back home using temporary comfortable teeth. After about 3 to 4 months, you're ready for the second stage. But listen to me, I just said after 3 to 4 months you are ready. You can wait 4, 5, 6, 7, 8 months, a year, and then come back again whenever you are ready, in two terms, financially and also when you're ready with your agenda. And at that time, in 1 week, we can do all the crowns that we needed to do. And this is the safest way, because we are guaranteeing you that the implants are going to be completely osseointegrated and ready to be used. Right. And they're going to be problem-free over time. The other option, which is a more new type of approach, is the immediate loading protocol. What it means is that you, as a patient, would come in, but if you're missing 2 or 3 teeth, you want me to put the implants in and fabricate the crowns immediately and go home in 1 week.
In the same visit?
In the same visit.
Or in the same period of time that you're here?
Exactly.
Right.
You will only need to come to Costa Rica once. There are good things and bad things. We use it, let's say, in about 20% of all of our patients. Why? Because you need to have different qualifications. For example, good quality and good quantity of bone. You need to be healthy, and you don't and you cannot be a smoker. Of course, diabetes is also a factor. In the classic two-stage protocol, I can work around those factors. In the immediate loading, it's critical that you cannot smoke and you have your blood sugar controlled in order for this to be a success. And also the bone quality, it's a very important issue. So only by a phone call or by an x-ray, it's impossible for me or for any other dentist that I know about to determine if you're a candidate for immediate loading. I would prefer to plan every case around the class 2-stage protocol, and if you have good bone, once you're here and I have all the evaluation done by 3D tomographies and my clinical evaluation, and we determine that we can do the immediate loading protocol, then we go ahead with that option.
Yeah, I have the reason why this is so important, and that I wanted for our readers out there, is that I want to make them understand completely and clearly that a lot of times in people looking for the best price for dental work here in Costa Rica, they'll go to one dentist, and the dentist will say for a 2-step protocol it may be $12,000, and then I'll talk to another dentist who'll say, well, no, I'll do the immediate loading for half that amount of money, which sounds good, but then once again, Dr. Mario, the dangers of someone misdiagnosing a person's candidacy for being ready for immediate loading. What could happen if someone is not truly a candidate for immediate loading after they receive it?
They can lose everything, implants and that prosthetic work, in less than 3 to 6 months. As easy as that.
Right. So this is something that's critical, once again, because Dr. Mario's specialty is in implant dentistry. And of course, we all know that people shop for dental prices, and it's a competitive business. We all understand that. But the important thing is not only to get a good price, but to make sure that you get quality workmanship that will last a lifetime. And that's the real purpose of getting dental work done here at Costa Rica Implant Dentistry.
Once again, I'm Dr. Mario Garita, and I want to invite you to our office here in Costa Rica to solve your dental needs. You will be completely satisfied, and just like hundreds of American patients just like you, they are looking for high quality dentistry at a fair price. We're here to help you.